Senior health secret: why you should rub castor oil on your belly at night. Shocking benefits. Welcome back, wellness seekers, to our channel dedicated to exploring natural approaches that may support your health and well-being, especially as we embrace our senior years. Today, we're diving into a fascinating and somewhat unconventional practice that has gained traction in natural health circles: rubbing castor oil on your belly before bed. Now, before we delve into the potential shocking benefits some proponents claim, please understand that the information presented in this video is for educational purposes only. We are not medical professionals, and this content should not be interpreted as medical advice. It is absolutely crucial to consult with your doctor or healthcare provider before trying any new health practice, especially if you have any pre-existing health conditions or are taking medications. That being said, castor oil, derived from the seeds of the castor bean plant, has a long history of traditional use for various purposes. Applying it topically to the abdomen before sleep is a practice that many believe can offer a range of surprising benefits. If you're intrigued by this natural remedy and curious about the potential overnight effects of rubbing castor oil on your belly, you've come to the right place. Let's gently explore the purported benefits, keeping in mind the importance of individual experiences and professional medical guidance. If you find this information interesting, please give this video a thumbs up and consider subscribing to our channel for more explorations into natural wellness approaches. Castor oil is a vegetable oil that has been used for centuries in various traditional medicine systems. Its primary component is ricinoleic acid, a unique fatty acid that makes up about 90% of the oil's composition. This ricinoleic acid is believed to be responsible for many of the oil's purported therapeutic properties when applied topically. The practice of applying castor oil to the abdomen, often in the form of a castor oil pack, a cloth soaked in the oil placed on the belly with heat, is a well-known folk remedy. However, simply rubbing the oil onto the belly before bed is a less intensive but still potentially beneficial approach, according to some anecdotal evidence and emerging research in related areas. Let's explore some of the potential things that might happen when you gently massage castor oil onto your belly before you sleep. Always remembering that scientific evidence specifically on this practice is still limited, and individual results can vary significantly. Potential support for digestive comfort. Overnight. One of the most commonly cited benefits of topical castor oil application to the abdomen is its potential to promote digestive comfort. Stimulating peristalsis. Some traditional uses and limited research suggest that ricinoleic acid may have a mild stimulating effect on the smooth muscles in the intestines, potentially promoting peristalsis, the wave-like contractions that move food through the digestive tract. Applying castor oil to the belly before bed might gently encourage this process overnight, potentially easing constipation or feelings of fullness and bloating in the morning. Reducing inflammation in the gut. As we'll discuss later, castor oil may possess some anti-inflammatory properties. Applying it topically to the abdomen could potentially help soothe inflammation in the digestive tract overnight, which might contribute to reduced discomfort. Promoting relaxation. The gentle act of massaging the oil onto your belly before sleep can be a relaxing ritual in itself. Reduced stress and tension can positively impact digestive function. Important note: while some individuals report digestive relief with castor oil, it's not a proven treatment for chronic digestive issues and should not replace medical advice or prescribed treatments. Possible soothing of abdominal discomfort. During sleep. Beyond general digestion, some believe that castor oil applied topically can help soothe various types of abdominal discomfort. Muscle relaxation. The gentle warmth of your hand during massage and the potential penetration of the oil might help relax tense abdominal muscles, potentially easing cramps or spasms. Nerve soothing. Some anecdotal reports suggest that castor oil can have a soothing effect on nerves in the abdominal area, potentially reducing sensations of discomfort. However, scientific evidence for this specific mechanism is lacking. Important note: persistent or severe abdominal pain can be a sign of a serious medical condition and requires prompt evaluation by a healthcare professional. Castor oil should not be used to self-treat significant pain. Potential support for liver. Detoxification processes. Overnight. The liver is a vital organ responsible for detoxification, and some natural health practitioners believe that castor oil packs or topical application can support its function. Increase circulation. The massage involved in applying castor oil might help increase blood flow to the liver area, theoretically supporting its metabolic processes. Lymphatic stimulation. Some proponents suggest that castor oil can stimulate lymphatic drainage. The lymphatic system plays a role in removing waste products from the body, and the liver relies on a healthy lymphatic system. Applying oil to the abdomen could potentially support this drainage overnight. Limited direct evidence. While castor oil has been associated with some effects on liver enzymes in animal studies, when ingested, not topically, direct scientific evidence demonstrating a significant overnight detoxification benefit from topical application in humans is limited. Important note: your liver is a highly efficient detoxification system, and while castor oil might offer some mild support, it's not a proven detoxification treatment and should not replace healthy lifestyle choices that support liver function. Possible reduction in systemic inflammation over time. Ricinoleic acid, the main component of castor oil, has been shown in some in vitro, test tube, and animal studies to possess anti-inflammatory properties. Inhibition of inflammatory mediators. Some research suggests that ricinoleic acid can inhibit the release of certain pro-inflammatory molecules in the body. While these studies didn't involve topical application to the belly, specifically in humans, it's theorized that the oil might be absorbed through the skin to some extent and exert mild systemic anti-inflammatory effects over time with regular nighttime use. Supporting the gut microbiome, indirectly. As we discussed in a previous video, a healthy gut microbiome plays a crucial role in regulating inflammation. If castor oil helps improve digestive comfort and potentially supports a balanced gut environment, though more research is needed, this could indirectly contribute to reduced systemic inflammation. Important note: the potential systemic anti-inflammatory effects of topical castor oil application are still under investigation and should not be considered a primary treatment for inflammatory conditions. Potential for improved sleep quality, indirectly. Similar to our discussion about garlic, castor oil itself isn't a known sedative, but its potential benefits could indirectly contribute to better sleep. Reduced discomfort. If applying castor oil helps alleviate abdominal discomfort or promotes relaxation, this could lead to a more comfortable and restful night's sleep. Placebo effect. The act of engaging in a calming nighttime ritual, believing it will help, can sometimes lead to improved sleep quality through the placebo effect. Important note: if you experience persistent sleep problems, it's essential to consult with a healthcare professional to identify and address the underlying causes. Possible improvement in skin health in the abdominal area. Applying any natural oil to the skin can have moisturizing and soothing effects. Emollient properties. Castor oil is an emollient, meaning it can help soften and moisturize the skin, potentially reducing dryness or irritation in the abdominal area. Antimicrobial properties. Topical. Some research suggests that ricinoleic acid has antimicrobial properties. Applying castor oil to the skin might help protect against minor skin irritations or infections in the abdominal region. Important note: while castor oil can be moisturizing, it's a thick oil and may not be suitable for all skin types. Perform a patch test on a small area of skin before applying it to a larger area. Anecdotal reports of improved energy levels, indirectly. Some individuals who use castor oil packs or apply it topically to the belly report feeling more energetic. This is likely an indirect effect resulting from improved digestion, reduced discomfort, or better sleep. When your body isn't expending energy dealing with digestive issues or inflammation, you may naturally feel more energetic. Important note: improved energy levels are a subjective experience and can be influenced by many factors. Castor oil is not a direct energy booster. While the potential benefits of rubbing castor oil on your belly at night are intriguing, it's crucial to be aware of the potential downsides and important precautions. Potential downsides and precautions. Skin irritation. Castor oil can be irritating to some people's skin. Always perform a patch test on a small area before applying it to your entire abdomen. Messiness. Castor oil is a thick and somewhat sticky oil that can stain clothing and bedding. Take precautions to protect these items. Digestive upset, if ingested accidentally. While we're discussing topical application, ingesting castor oil can have a strong laxative effect and should be avoided unless specifically directed by a healthcare professional. Pregnancy and breastfeeding. Castor oil is traditionally used to induce labor and is generally not recommended for pregnant women. Its safety during breastfeeding is also not well established, so consultation with a doctor is essential. Drug interactions. While less likely with topical application, there's always a potential for interactions with certain medications. Discuss this practice with your doctor if you are taking any prescription or over-the-counter drugs. Lack of robust scientific evidence. It's important to reiterate that much of the evidence supporting the benefits of topical castor oil application, especially for the specific practice of rubbing it on the belly at night, is anecdotal or based on traditional use rather than rigorous scientific studies in humans. How to rub castor oil on your belly. Before bed, if you choose to. If, after considering the potential benefits and downsides and consulting with your doctor, you decide to try this practice, here's a suggested method. Choose a high-quality cold-pressed castor oil. This type of oil is generally considered to be the purest and most beneficial. Apply a small amount. Start with about 1–2 tablespoons of oil in the palm of your hand. You can always add more if needed. Gently. Massage. Using circular motions, gently massage the oil onto your entire abdominal area for a few minutes. Cover. Optional. You can cover your belly with an old cotton cloth or towel to protect your bedding from staining. Leave overnight. Allow the oil to absorb overnight. Cleanse in the morning. Optional. You can cleanse your skin in the morning with a mild soap and water if you feel it's necessary. Some people also choose to place a warm compress or hot water bottle over the oiled belly for about 15–20 minutes after application to potentially enhance absorption and relaxation. In conclusion, the practice of rubbing castor oil on your belly at night is a folk remedy with a long history and numerous anecdotal claims of shocking benefits, particularly related to digestive comfort, reduced inflammation, and potential support for liver function. While the ricinoleic acid in castor oil does possess some scientifically recognized properties that could contribute to these effects with topical absorption, robust scientific evidence specifically validating the overnight benefits of this particular practice in humans is still limited. It's essential to approach this remedy with cautious optimism, to listen to your body's response, and, most importantly, to prioritize consultation with your doctor or healthcare provider before making it a regular part of your nighttime routine. Castor oil may offer some soothing and supportive effects for some individuals, but it's not a cure-all and should not replace conventional medical treatments for any health condition. Thank you for joining us on this exploration of the potential overnight effects of rubbing castor oil on your belly. We hope this information has been informative and has empowered you to make well-considered decisions about your health. If you found this video insightful, please give it a thumbs up and consider subscribing to our channel for more explorations into natural wellness approaches for seniors. We truly appreciate your support. Remember, your health is your greatest asset, and making informed choices in consultation with your healthcare team is always the best path. Sweet dreams and healthy nights to you all.